Local doctors held a virtual town hall today to talk about the dangers of COVID-19 in our children. And one focus, the COVID-19 vaccine and multi-system inflammatory syndrome in children. It's also called MIS-C. KXAN's Jennifer Sanders explains.
I was an average kid, basically. I was healthy, I had no breathing problems, and it hit me hard.
Nico D'Alessandro is talking about his 8-month battle with multi-system inflammatory syndrome, or MIS-C. The rare post-COVID illness, which affects children, can cause inflammation to different body parts, including the heart and the lungs.
I can barely move my neck. I was puking. I was nauseous. I couldn't talk straight yet sometimes.
He recently got his second dose of the COVID-19 vaccine and says he only experienced nausea. In a Pfizer study, researchers found that no MIS-C cases were reported post-vaccination. Doctors from Travis County Medical Society and Dell Medical School diving into the impact of the vaccine on MIS-C patients in a virtual town hall Wednesday.
The CDC does recommend vaccination for patients with the MIS history, but waiting 90 days.
That's what Dr. Lynn Thorson is also advising. She's seen MIS-C cases double in the last week compared to the week prior.
Because we had so much COVID in the community, the end of July through August, we expect now, as we see the end of September into October, that those MIS-C cases are just going to increase.
She's still seeing many of the same symptoms like fever and vomiting, but there are concerns about the impact of new variants.
I think people have the question about whether the Delta variant would give us different symptoms with MIS-C. So far, we haven't seen that.
Get vaccinated or wear a mask. I don't want anyone else suffering for what I went through.
In Austin, Jennifer Sanders, KXAN News.
The CDC has been tracking cases of MIS-C since reporting began last year. Georgia and California have had the highest number of cases with more than 300. Texas has had between 200 and 249 cases. Vermont is the only state that has not reported a single case of MIS-C.